Welcome back to the Lost Book of Herbal Remedies, where we uncover fascinating insights about health and wellness. I'm Emma, and today we're tackling a pressing issue: the alarming impact of pandemics, specifically COVID-19, on adolescent brain development and mental health.
That's right, Emma. The pandemic has left deep scars on all of us, but adolescents in particular have faced unique challenges. Their brains are still developing, and the lockdowns, isolation, and stress have accelerated some of these changes in ways we're just beginning to understand.
Exactly, Alex. Studies have shown that COVID-19 has led to accelerated brain maturation, especially in adolescent girls. Researchers observed widespread cortical thinning in areas like the fusiform gyrus, insula, and superior temporal cortex, areas responsible for social cognition. In contrast, boys experienced cortical thinning mainly in the occipital lobe.
And this accelerated maturation is not necessarily a good thing. It may increase the risk for neuropsychiatric and behavioral disorders. Adolescents are already in a critical phase of emotional and social development, and this disruption could lead to long-term mental health challenges.
That's such an important point, Alex. Adolescents need social interaction to develop properly, but the pandemic isolated them, leaving many to cope with stress and uncertainty on their own. We're now seeing a sharp rise in mental health issues, things like anxiety, depression, and even behavioral disorders.
And it's not just the isolation. The immune response to COVID-19 also plays a role. Research shows that the immune system, especially in convalescent patients, undergoes significant changes post-COVID. Inflammation can persist and may contribute to ongoing mental health problems, as inflammation is linked to psychiatric disorders like anxiety and depression.
Right. It's a complex interplay between the immune system and mental health. The immune dysregulation caused by COVID-19 could be making it harder for adolescents to recover, both physically and mentally.
And that's why continuous monitoring is key. We need to watch for mental health symptoms over time. A longitudinal study published in Psychological Medicine showed that mental health symptoms, especially anxiety and depression, rose in children and adolescents throughout the pandemic and even spiked again after lockdowns ended.
That's so concerning. It shows that while some kids may have adjusted to the new normal, others are still struggling with a resurgence of mental health issues as life slowly returns to normal.
Exactly. This is why timely mental health interventions are so important. We can't assume that things are back to normal for these adolescents. Ongoing support is crucial.
And another aspect that we can't overlook is the intense loneliness many adolescents experience during lockdowns. A study conducted in Japan found that feelings of social isolation persisted for 2 years after the initial emergency declarations. Even as other parts of life improved, loneliness remained a significant issue.
Loneliness is such a powerful contributor to mental health decline. We're talking about reduced face-to-face interactions, broken relationships with familiar people. These are the things that kept adolescents connected and emotionally healthy before the pandemic.
That's right. And what makes it worse is the negative outlooks many young people had about the future during this time. These feelings of hopelessness and uncertainty only deepened their sense of isolation.
And speaking of uncertainty, intolerance of uncertainty, IU, played a huge role during the pandemic. Adolescents with high IU were more likely to experience depressive symptoms, especially if they used negative coping strategies.
That's an interesting point. The pandemic certainly tested everyone's ability to handle uncertainty, but adolescents in particular struggled. Positive coping strategies, like mindfulness or physical activity, can mitigate some of these effects, but those who turned to negative coping methods fared much worse.
And it's not just coping mechanisms. How adolescents perceived the risk of COVID-19 had a direct effect on their emotional health. Those with higher risk perceptions experienced more anxiety and depression. This was particularly evident in cultures where fear and uncertainty about the virus were heightened.
That's so true, Alex. Adolescents were navigating a really complicated landscape, and their emotional responses to the pandemic were influenced by so many factors: risk perception, social isolation, immune response, and uncertainty. It's a lot for any young person to handle.
Absolutely. That's where herbal remedies and holistic strategies come in. There are natural options to support adolescents' mental health and help them cope with the long-term effects of the pandemic.
One of the best options is ashwagandha. known for its adaptogenic properties. It helps reduce stress and anxiety, something adolescents need now more than ever. It also has neuroprotective effects, which could help counteract the accelerated brain maturation we're seeing.
And then there's Baikal Skullcap, which is packed with anti-inflammatory compounds like baikalin. It helps modulate the immune response, reducing inflammation that could be linked to ongoing mental health issues after COVID-19.
Rhodiola rosea is another great adaptogen. It boosts resilience to stress, improves cognitive function, and helps combat fatigue, depression, and anxiety. Adolescents facing these challenges could really benefit from it.
And let's not forget Nigella sativa, also known as black seed. It's a powerful anti-inflammatory and neuroprotective herb that can help regulate the immune system, which is crucial for mental well-being post-COVID.
Absolutely. And green tea with L-theanine and EGCG promotes relaxation and cognitive clarity. L-theanine is particularly good at reducing anxiety without causing drowsiness, making it perfect for stressed-out teens.
Another herb worth mentioning is Bacopa monnieri. It's well known for enhancing memory and attention, and it can also reduce stress and anxiety. It's perfect for supporting brain health during such a critical development period.
Not to mention omega-3 fatty acids from algal oil. These are essential for brain health and can reduce inflammation. They're critical for maintaining the structure and function of neurons, especially during adolescence.
But it's important to be cautious. Anyone considering an herbal regimen should consult with a healthcare provider, especially since some herbs can interact with medications or pre-existing conditions.
That's true, Alex. We always recommend starting with lower doses to assess tolerance and sourcing herbs from reliable, reputable providers to ensure quality and safety.
Exactly. Supporting adolescent brain health and mental well-being in the aftermath of the pandemic requires a holistic approach. By combining herbs with evidence-based mental health strategies, we can help these young people recover and thrive.
If you're interested in learning more about how to support adolescent mental health with herbal remedies, check out our full article on the topic. It's packed with more detailed insights and research-backed strategies.
Thanks for joining us today. We hope this episode gave you a fresh perspective on the challenges adolescents are facing post-pandemic and how we can support their mental health moving forward.
Take care, everyone, and remember, holistic health is about supporting the body and mind together.